Doctor, the replantation of an extremity is what? That is a restorative surgery of an accidentally amputated limb to its functional capacity, including what, doctor? Well, it includes the restoration of circulation by anastomosis of the blood vessels. Anything else, doctor? The internal fixation of the diaphyseal fracture of the bone by intramedullary nail. Anything else, doctor? The repair of nerves and tendons, as well as the debridement of devitalized tissue. Doctor, is there such a thing as a closure by suturing undamaged soft tissue? Yes, that is of dismembered limbs to the stump. And a split thickness graft for denuded skin areas would be included in that surgery? Yes, it would. What is sequestrectomy? Sequestrectomy is the surgical removal of a piece of dead bone. And the surgical correction of the fracture is what? Well, it may be achieved by closed reduction, insertion of plate and screws, insertion of medullary nail, insertion of a nail with a side plate, and finally the insertion of a hip prosthesis. Doctor, that closed reduction that you mentioned involves manipulation and application of the cast or application of the splint or traction apparatus in selected cases? Yes, it does, when the fractured ends are not in alignment. And what about when there is an insertion of a medullary nail? Well, for diaphyseal fractures, that is, shaft of the long bones, there is the extraction of the nail after bony union. Doctor, is there a femoral neck fracture involved in this patient? Yes, we had to do that. And what happened? Well, occasionally prostheses are used for severe fractures of the upper or lower end of the humerus. Is that a simple immobilization? Yes, a simple immobilization, that is, the application of a cast or splint when the fractured ends are in apposition. Doctor, was there a surgical correction of facial defects in this patient? Yes, there was. What were they? There was a bone grafting of hemimandibular defects, also a bone graft reconstruction following hemimandibulectomies, and finally, a craniofacial osteotomy for correction of a facial anomaly. Doctor, did you have in your hospital record any symptomatic terms? Yes. What were they? Well, there was callus, which is a substance growing between ends of fractured bone and converted into osseous tissue. What is osseous tissue? Osseous tissue is a fancy phrase for a bone. And was there crepitation? Yes, there was crepitation. What is crepitation, doctor? Crepitation is grating sound made by movement of fractured bones. Was there a decalcification? Yes. And what is decalcification, doctor? The removal of lime salts, especially from bone. What about ostealgia? Well, osteodynia is bone pain. And what do they mean by a phantom limb pain? A phantom limb pain is a painful sensation felt by an amputee as if the limb were still intact, probably of central origin. Doctor, finally, there was the ligament here, was there? Yes. And he also suffered from a lordosis, which is a bending backbone, as well as a subluxation or dislocation. Doctor, the painful sensation felt by the amputee as if the limb were still intact is called what? I said before, the phantom limb pain. How's it?
Accurate. Sorry, I have to restart my computer. It's going crazy. I just need a short